79% of women that they surveyed felt that the cellulite that they had was their fault.
It's not.
That's messed up.
Yeah,
it's not. You're born with it.
It's just there.
Yeah, it's just there.
It's just how your body is.
Hey guys, welcome to Unfilter It with
Lindsey
and China. We're here to tell you all the insider secrets.
All right.
What are we talking about today?
Today we are going to talk about energy-based devices.
And what the heck is that?
So that means lasers, ultrasound,
laser beams,
stuff like that. So let's hit it. So pick one. What's your favorite?
Okay.
What do you think?
Favorite, right, or with the most hype right now, I would say, is RF microneedling.
Hands down.
Let's talk about it.
There's so many brands of that.
So many brands.
Hopefully we'll be getting the Morpheus soon. So, but let's just talk about it as a whole, because there is so many different brands. I don't know which one's better than the other.
How many patients are you getting asking you about, like, what is this RF microneedling?
Everybody, all day, every day. DMs are crazy about it.
Yeah.
So
here's my experience with RF microneedling. I think it's a great treatment. It could be used pretty much everywhere and pretty much for everything. Mm-hmm. So RF microneedling, it basically, let's talk about what does it do. So it's these little needles that are entering the skin and depositing a cautery type of energy where in whatever level you want it to go. And many of the devices that are out there now go anywhere from 1 millimeter to 8 millimeters, depending on what you're trying to treat.
Yep.
So it's fractionated, meaning that it's making these like holes in a grid so that in between the holes is free, undamaged tissue so that healing happens fast. So there's usually minimal downtime with these types of treatments, and you can treat the face, the body, acne scars, surgical scars,
crepey skin, under eyes are a good thing.
Yeah,
I think a lot of people, stretch marks, it helps them, or even just like, you know, instead of doing like something like Kybella under the neck, so
some of the devices
under your chin. You can
dissolve
do some
fat.
microneedling there. It goes deep enough now. When they first came out, it didn't go deep enough to do that, but now it does.
What's cool about the RF microneedling for the submental, let's just talk about that for a second. So Kybella is an injectable treatment that dissolves fat. So if you have a small pocket of fat underneath your chin, you would dissolve it with this substance. You'd have a lot of swelling. And then what would happen in some people is that then the skin would sag and it would look kind of weird, right?
Unless you just have like a little tiny chicken nugget under there.
Or unless you're 20.
You need more. Yeah,
you know, but
really
if you're of a seasoned age like us, then
you need something.
You would need
something
for skin tightening. So so this treatment is good because it will target fat cells, melt the fat to some degree, cause an inflammatory response, but it's also treating the skin layers, which we know that if you target the dermis at a certain temperature, 43 degrees Celsius, if you really want to know. If you really needed to know.
Then it tightens.
It tightens, and it causes collagenesis, which is an increase in collagen.
So I feel like that's a good thing for submental, or who doesn't know submental, under the double chin. That's the area underneath your chin.
And my personal opinion for that area is that the microneedling devices with the RF surpasses some of the cryo treatments for fat reduction. I won't mention names because it's not a favorite of mine for the submental area.
It doesn't really tighten the skin.
It doesn't tighten the skin.
So I feel like you really kill two birds with one stone.
Yeah, so if you're looking for skin tightening and fat remodeling is what a lot of the companies call it, which is also good for cellulite.
Yes.
Let's talk about cellulite for a second.
Cellulite. So I find in all my years of life that everybody has cellulite. Babies have cellulite. Please stop beating yourself up if you have cellulite. When I go on vacation, I get a spray tan that helps to hide my cellulite.
So actually, It Aesthetix did a study on this a couple years back, and it was a question, it was a survey type of study, and I forget the exact number, so don't quote me on this, but it was somewhere around like 79% of women that they surveyed felt that the cellulite that they had was their fault.
It's not.
That's messed up.
Yeah,
it's not. You're
that's
born with
messed up.
it.
It's just there.
Yeah, it's just there.
It's just how your body is.
Well,
Everybody's.
what is cellulite? Cellulite is actually caused by these collagen bands that tether down the skin. If you think about
that's all it is.
tufted pillow,
It's the same thing.
that's exactly
If you
what
like
it
your
is.
quilted Chanel bag.
It's like
It's
my
cellulite.
Chanel bag. It's basically cellulite.
Yeah.
So the way that you actually get rid of cellulite on a surgical mindset is you have to snip those bands, which is
Only
not
way.
always good, because sometimes when you snip those bands, if you have skin laxity,
Then what?
everything falls
Then it's
down,
saggy. Then
and then
you
your
hate
butt is your thigh.
Yeah,
We don't want that.
That's like me. Yeah. So, yeah.
We have treatments for that too.
Yeah.
We'll touch
so
upon
let's
it
talk
another
another one.
episode.
So next
cellulite.
one.
No, wait,
Oh,
cellulite. We
sorry.
didn't finish
We're
the
still on
cellulite. So cellulite, if you're not snipping the bands and you want to just smooth out the tissue and you want to remodel that tissue, then RF microneedling is a good option, because you're sparing the superficial tissue and just
Probably
targeting
hits the bands a little bit too.
It does. I
Some of
believe
them.
that it does.
Especially if you go down to 8 millimeter, it could get there.
So one of the big questions that I get in consults a lot about RF microneedling is, how am I going to tolerate it? Because there's lots of, stuff out there on TikTok, and I know many celebrities were doing treatments online. Does it hurt?
Yes.
Is the question.
The answer is yes.
The answer is yes.
All these things hurt.
So Lindsay and I come from a day and we have a surgical background, right?
all
So
hurts.
back in our day when we were
used to everyone
trained,
being asleep.
if you didn't look like you got hit by a bus,
it
you
didn't
weren't
work.
going to
It's
get
not-
a good
it didn't
result.
work.
Like
It
you
didn't
had to look like you were beaten pumpkin head.
You know what?
sized.
No, I changed. We'll also talk about a different device, but I changed my thought on that a little bit, because with the one device we'll talk about, people are having almost zero downtime, and I
Yeah,
am seeing
so-
results in skin tightening.
Yeah, I was gonna say, so back in our day, we thought if you didn't look like you've been through a
hit by a
car
Mack truck.
accident,
Yeah.
you weren't gonna have a result. And then these non-invasive devices started coming around, and when I was first in the market for these devices, the reps would show me pictures of before and after. I'll be like, that's immediately after? What do you mean
not
they have
gonna
no
work.
downtime? Nothing's gonna
Yeah,
happen.
agreed.
And I would follow up my patients at 1 month, and I'd be like, yeah, see, it didn't work. Nothing's happening. And then at 3 months, they would come back, and 3 months is around the time where we start to get collagen building
takes
and
about 6 to 8
elastin.
weeks usually.
Right?
So that 3-month mark's pretty
at
good.
3 months, they would
Yeah.
come back. I'd be like, holy
Wait a second.
mackerel, that really did something.
So it's kind of hard to retrain our thinking.
Yeah,
to
it took a
that.
while.
You need to look like a train wreck
It
for
took a
actually
while.
something to actually happen.
But I think
Yeah.
also with the times, we are way busier now than we were
100%.
back then.
I
So
think
no one's
patients
got time.
No one wants the downtime.
Insert the video of no one got time for that.
Yeah.
That's what we have to insert there.
Ain't nobody got time.
Ain't nobody got time for that. So
No one does these days. So
yeah,
that's
so
what-
these
that's what's
devices
great.
are good. So
I feel
yeah,
like people really are leaning more towards things with max a week downtime. And
Max.
even they don't want to be they can't go anywhere.
yeah. So RF microneedling,
right.
what's your take? Thumbs up or thumbs down?
Thumbs up.
Thumbs up for me
Thumbs
too.
up.
So thumbs up, good treatment. Let's segue into exactly what you just said. I know where you're going with this one, girl.
Yeah, so we purchased a machine last year, a device. I will say what it is called Soft Wave, ultrasonic skin tightening, ultrasonic heat. A lot of people might have heard of Ultherapy.
The old dogs,
or
the old
Thermage.
dogs.
Well, Thermage is also radio frequency. So whatever. So it's newer, and why I like this one is because you could use it any time of the year. So all year. Most lasers or radio frequency, you got to be really careful in the summer for hyperpigmentation. You could also use it on all skin types. So my darker skin patients, I wasn't able to offer them anything because you worry about hyperpigmentation.
Right.
Or you can't go as high on the
energy.
the energy because of their skin tone. So I wanted something that I could really offer anybody at any time, because I if someone wants something, they should be able to get something for themselves. So
Especially in the skin tightening market, because I feel like
Yeah.
everybody needs skin tightening. And years ago, we were very limited as to what energy-based devices
Correct.
we could use on skin
Yeah.
of color.
Right.
And now it's getting better. It's getting better,
way
guys. There's
better.
hope.
So Soft Wave is awesome. Patients are really loving it. And again, it is around that 3-month mark, but I have seen patients back a couple weeks later for their Botox or filler, and they are seeing some really good results early on, brow lift, all that kind of stuff.
Yeah.
So I love it.
Yeah. So back in the day, and I know like Ultherapy is a device that's pretty well known because it's been around for a long time. So that is using ultrasound energy. It's an ultrasound-based device that also drills into the tissues on different planes, and it causes a heat injury under the skin, which then in turn tightens tissue, causes collagen. They're all collagen builders, basically. So what, Lindsey, is the difference between the Ultherapy treatment and the Soft Wave? So
I like Soft Wave, and Ultherapy is good too. But the biggest difference to me is how the energy is spread.
Right.
So Ultherapy kind of goes down to a pinpoint. So if you think of it like an ice cream cone, so you have your handpiece on the skin, and then it's going zoom down to the point of an ice cream cone. So think of how many passes you have to do, how the precision you need to actually be able to get every little tiny part of your patient's skin.
And I think that was a con of the Ultherapy product was
because it's hard to tell where did I exactly get it.
And it was very like user dependent. Like your provider had to really know how to read an ultrasound to know where exactly in the tissue are you. And the complications that were coming out of that was, in my opinion, just due to the person not knowing what plane that they were in and treating too deeply,
or just double hitting it,
or double hitting it,
any of that.
Getting the good fat that's in our face affected, where then they cause more skin laxity.
Right. So there's a lot of different things with that, but the difference, and then Soft Wave, it's a parallel beam, so it's really spread across a longer beam. It's not a pinpoint, so you can get through the treatment quicker. I feel like it's less hits that you have to, or pulses, they call them pulses.
And the Soft Wave is targeting just the dermis.
Correct.
Because it's only going down like 1.5 millimeters, I believe. Yeah. And what's cool is that it takes the user error out, because you don't have to like view on an ultrasound screen what you're looking at. So yeah, I agree.
Thumbs up.
Thumbs up.
Soft Wave.
The only thing I have to say about the Soft Wave treatment or ultrasound treatments in general is that they're hot. They hurt.
No, right. Well, we did talk about it with radio frequency microneedling. Soft Wave, ultrasound-based heat with anything, and even if it's radio frequency.
So how do we minimize? How do we make it comfortable?
It hurts. If it doesn't hurt, nothing's
We
happening.
make it comfortable though. We have a lot of good options.
A lot of numbing
for pain.
cream, Pronox coming,
cold air, nitrous gas.
I haven't had anybody smack me off of them.
No one's run away.
No one's left.
And the nice thing too, and tell me if you feel the same way. Like Soft Wave is usually like one treatment. They don't usually have to do.
It depends on the patient. So what I tell my patients, I say, listen, if you just want to kind of keep yourself where you're at, get a little bit of tightening, and do it more for an anti-aging, prophylactic to aging, then you do it once a year, once every other year, something like that. If you're older and you're hating on, some skin laxity and things like that, then you probably want to do it every 6 months till you're happy. So most of your results are at that 3-month mark, but I have seen patients after 6 months have a little more result, and then they have repeated. They like it so much that they're
What's
repeating
cool about it
is
there's zero downtime. It's kind of like shrink wrap. Oh, the other thing I'd like to mention about the Soft Wave is I believe that they are the only ones that have FDA approval off the body for cellulite and stretch marks, maybe? Or maybe stretch marks is coming.
I think it's just body cellulite. So that's really interesting.
So going back on the topic of cellulite, some people think that they have cellulite when truly they just have skin laxity. So I think that this is good in that market of people that
kind of hit both.
Yeah, and I feel like everybody has skin laxity unless you're 12.
Who doesn't? Right, unless you're just born. Unless you're
a
embryo.
baby.
Yeah. But everyone has some skin laxity.
So thumbs up for ultrasound,
ultrasound-based heat. I also want to say something that in comparison to the other heat devices that do not include needles, I think Soft Wave probably hurts the least. The pain the heat kind of creeps up, and it's about a 1 second of like a hot poker, I would
Yeah,
say, and then boom, it's done. When I've treated patients with the other devices, it's hot the whole time.
Yeah,
so
I
I
would
feel
not
like,
like
you know,
that.
and in some zones they don't feel it at all.
Right.
So I do feel like
yeah, it's definitely a crescendo. Like you feel the heat
It's coming
building,
up, and then
you're like,
hot.
oh man, it's hot, and then
and then
it's
it
cold.
drops up. Someone
Yeah.
said this is going to age us, but they said think of the hitchhiker in The Price is Right.
Yeah.
How he comes up and he's yodeling
Yeah,
and he boom
and then
falls off
boom.
the mountain. So it's
Exactly.
kind of like that, 200 times.
200,000 times. So yeah, so what you can expect coming in for really both of those treatments, either the microneedling with RF or the ultrasound-based devices, is your appointment's going to be long. You're
Yeah,
going to
be
be
here for
numbing.
2 hours.
Yeah, you'll numb for about 45 minutes, and then the treatment probably takes around 45
Yeah,
minutes
we'll
too.
take
Once
pictures. We
Yeah.
factor all that time in. Yeah, you go to the bathroom if you got to go.
Yeah.
All that good stuff.
Yeah. All right, so we both say thumbs up.
Thumbs up.
Cool. So the next one that we're going to hit on, and then maybe we make a part 2, because
Yes.
there's so many things
There's
to
a
talk
zillion
about.
things. All right, which
is-
one? You
Let's
pick.
talk about
You pick.
Pico.
All right,
Pico
Pico.
laser, because I
I
think,
like Pico mostly for tattoo removal.
but I think
That's my
Pico
jam.
encompasses a lot. So
It's
like
huge.
you can do a lot with that. So what is Pico? It's a fast laser. Many of them are different types of laser. It doesn't matter, but basically
It's just the speed. That's
it's
what
the
Pico means.
speed.
It's a Pico.
And because it's so fast, it becomes photoacoustic rather than photothermal. So what does that mean for the layperson? If you have a darker skin tone or melasma, you can't use the photothermic lasers that are going
Like,
to create heat under the skin.
like IPL.
Yeah, like IPL.
You can, but just
Or
at
like some
lower-
of the
lower
other
levels.
like erbiums or that sort of thing.
Right, so Pico's your jam.
So Pico's your jam because it's so fast that it turns into sound waves instead of heat waves. So I love the Pico because you can do tattoo removal, which I know you like doing with the Pico. You could
Yeah.
do acne treatments with something we call the carbon facial, where we put a carbon
great.
gel on your face and then we use the Pico to
Yeah,
target
you
the
could-
carbon,
You could do just
shrink
a photo
pores.
facial, like people might
Yeah,
just say.
it's
Pico
good
photo
for-
facial, love
for
it.
pigment.
Once a month, you could do Pico photo facials. You're just gonna be glowing.
There's even a Pico fractionated treatment that you could do. Yeah, that you can shrink pores and tighten skin and all of those things. So
There's so many things on that.
there's so many things, but most people are consulting us for tattoo removal.
I feel like
Yeah.
yes,
And
then
like-
if we see someone with acne, we say, "Hey, do the carbon."
Yeah.
Pico.
And
facial.
those of you who know me know that like tattoos are my jam. So I tend to have a lot of patients that come in for tattoo removal, though they're not fully removing. So why do we do that? If you're in the tattoo realm and you do large pieces, typically your tattoo artist is gonna, if you have like something that you regret or like some dumb, mom
you wanna
tattoo,
cover up.
and you want to cover up, your tattoo artist is gonna say, oh, go get it to grayscale so that we could do your
We could do
cover up
something
better.
easily.
Because
Yeah.
years ago, if you had a tattoo that was like this size or like the size of a quarter, you would need a full arm sleeve basically to cover
up.
it. So like now, I think because of the technology, it makes it much more
great.
accessible.
Yeah.
Yeah, and people can get the type of art that
And
they
usually,
want.
how many treatments would you say? 3, 4? Depends.
Six,
It depends on the
sometimes.
tattoo.
Yeah, it does depend on the tattoo
There's color
and the skin
involved.
tone.
It depends.
Yeah, I feel like what I stop telling my patients in consults, like how many sessions, now I give them a time frame. So like now I'll look at your tattoo and consult and I'll be like, all right, what's the goal? Are we trying to remove it completely or are you getting a
Lighten
cover
it.
up?
Yeah.
And then I'll give you a time frame. I'll say, okay, it's going to take a year and a half to remove.
I feel like honestly, they all take at least a year.
Yeah,
It doesn't
and I
matter.
don't think that people
Yeah.
realize that. They think like, oh, 6 sessions, I'll be
They
done
think
in
they're
6
just gonna
months.
have one, but I feel like it's the same for hair removal.
Yeah.
Like it all depends on you. But let's talk about for ink. It depends what kind of ink, how old the ink,
Right.
what is in the ink. Did they mix colors to make that ink? There's
Yeah.
so many different factors. How deep it is.
How many times
Yeah.
have you disappointed someone when they come in and they're like, I just got this tattoo 3 months ago and I want it off. And you're like, sorry, we'll see you back in 3 months.
Yeah,
and then
wait.
they get mad. But here's the why. The unfiltered version of this is because when you get a tattoo, it needs some time to settle into your dermis or beyond. So it depends on where your tattoo is and the depth of your skin and lots of factors. But you need that tattooing to really settle in and be happy in those squishy tissues for the laser to even do anything. So I'll anecdotally tell a story of a patient I had once that was like a young girl who got Roman numerals tattooed somewhere. I won't say where, so that she doesn't think I'm talking about her. But it was backwards. It was backwards from how she wanted it. I know it was total accident because when she looked in the mirror, it looked right, but like on her person, it wasn't. So she literally like left the tattoo shop, came in to see me, wanted it removed, and I was like, sorry, we can't. We gotta wait. She's like, what do you mean? So what would happen if you treated somebody who had a fresh tattoo? One, you don't want to laser someone when their skin is broken, so it has to heal.
You have to wait.
Two, if you laser it too soon, nothing's going to happen. It's just not going to do anything.
You know what happens? You waste your money.
We take your money. Yeah, we take your money and we go on vacation. I don't know. Which we wouldn't do because Lindsay and I are not in the market of ripping people off.
Correct.
But we wait. We just tell you to wait. So when we tell you to wait, please don't be mad at us. Just know.
Same thing. If we say no, don't be mad at us.
Don't be mad.
It's in your best interest.
It's just because we're not trying to rip you off and take your money.
It's true.
Well, I think that concludes part one.
That concludes part one
of our laser discussion. Let us know if you have any questions regarding the devices that we just talked about. I know we talked about a lot.
DM us, anything specific. If we confuse you at all, let us know. We'll get back to you.
Part two, we'll talk about Fraxel, which is a good one.
That's my fave.
Yeah, and IPL, laser hair removal. That's what we'll tackle in
we got to
part
get into laser hair removal because it's hard for patients to
laser hair removal. Fraxel part 2. Stay tuned.
Stay tuned. Unfilter it.
Unfilter it.